Greetings from Australia. We are delighted to be able to present our paper from afar on home transdisciplinary solutions to the health impacts of the Australian housing crisis at what sounds like a fascinating conference. There are three of us who will be presenting today. Fiona Andrews is from the School of Health and Social Development, Richard Tucker is from the School of Architecture, and Louise Johnson is from Arts and Education at Deakin University. Our presentation today will be in 4 parts. First, we'll provide some background information on housing and health in Australia and the Home Research Group. Then we will discuss 2 case studies that provide examples of work that underpin the establishment of home, followed by a discussion of future strategies for home as a research centre. According to the WHO in 1998, housing is fundamental to physical, mental and social well-being and quality of life. But what do we mean by housing? Clearly it's more than the physical structure of a building. We find Bonnefoy's framework useful in this respect. This describes 4 dimensions of housing, taking into consideration the physical structure of the dwelling, as well as the meaning of home, the external dimension of the immediate housing environment, and sense of community. Indirect and direct health effects can occur at each level of this framework. For example, security of tenure affects one's meaning of home and mental health. Inappropriate dwelling conditions, such as unsafe building materials, can result in injury or even death. Levels of social cohesion can affect perceptions of safety and psychosocial health, while poorly designed neighbourhoods can limit physical activity. The housing crisis in Australia comprises 7 major issues. Many are interrelated and all in different ways impact health and well-being. Time does not permit us to go into detail of all of these today. However, points 2 and 3 on this slide will be discussed in more detail in our case studies. First, a bit about home. To date in Australia, each discipline has viewed the housing crisis through its own lens. Thus, built environment, health, housing economics and social policy researchers have rarely come together to direct holistic solutions to the health impacts of the housing crisis. The formation of the home team offers a rare disciplinary combination in housing research in Australia. Diverse expertise located at the nexus of theory and practice in health, built environment, social inquiry, economics and law. Our aim is outlined on this slide. Our research will focus on 4 themes. A home for life, designed to be adaptable and universally accessible. A home we can afford, constructed to minimise negative environmental and health impacts, matching our means, and so a home that is sustainable collectively and individually. A home where we know neighbours, designed for social connectivity, encompassing diversity. And finally, a home that is connected, linked to occupations, services, education, nature, transport, play, food, and to the wider community. Today we will present 2 case studies that provide examples of some of the work members of the group have done to give you an idea of what we hope to build on for the future. Our first case study involved academics from health, geography and planning in collaboration with a local government municipality on the outer suburban fringe of Melbourne. The outer suburbs on the peri-urban boundary of all Australian major cities provide cheaper land for building larger, low-density housing than established inner and middle suburban areas. As such, they are popular residential locations, especially for Australian families raising children. However, the outer suburbs are not without their problems. Reports highlight the growing spatial divide between inner and outer suburbs in terms of service provision, employment, public transport and social disadvantage, along with concerns about less provision for physical activity, poor air quality due to high car emissions and fewer green spaces, and fewer opportunities for social interaction. The project I will discuss was located in one of the fastest growing local government areas in Australia, located approximately 35 kilometres from the CBD of Melbourne. The project was initiated by the local government, who were interested in trying to develop better suburbs in the community that provide more healthy, productive alternatives to current outer suburban design. The first stage of this project collated academic and planning literature and distilled from it some principles which might inform the development of a model suburb. In the second stage, we used resident-driven photo-elicited interviews to identify what was working and not working. 3 major themes were identified, which you can read about in more detail in our publications cited at the end of this presentation. What I will do today is focus on 2 examples of local-led responses to some of the above outer suburban housing issues, which could be built on by local policymakers, planners and developers. Developing a connection with one's surroundings and the people within them is an important aspect of our well-being. The Pirate Park example highlighted some of the challenges of placemaking in a new community. It was designed and marketed by a developer to attract families to their particular estate, but it ultimately became part of the wider suburb's identity. Residents described the iconic nature of the park, yet over time its value was clouded by unfavourable activities that took place there. The wooden ship part of the park was ultimately burned to the ground. Furthermore, when council organised a meeting to plan the rebuilding of the park, hardly anyone turned up and the park fell into disrepair. We see the implications of this example as threefold. Placemaking needs to actively occur, but it has to be grounded genuinely on the deep history of the area. All communities in Australia have an Indigenous history, usually not recognised. In the current study, residents also spoke positively of some of the settler historic features in the community, which could have been further developed and incorporated into placemaking activities. Placemaking needs to involve all in the community as active makers and remakers of the icons and sense of place. And finally, within new suburban areas, there can be a real sense of place despite its apparent absence. People make places out of where they are. They give meaning in spite of, not always because of, planning and developer decisions. The stresses posed by long commutes into the CBD of Melbourne and traffic congestion due to poorly designed local road networks meant a rethink of employment opportunities for some of our participants. While local jobs are a solution to this, the opportunities provided in the suburb were limited. Often residents were a step ahead of planners in this respect. One such example is highlighted on this slide. Wallace Avenue was a new industrial area originally developed to house blue-collar industries and employment. However, it was not fit for purpose and was reinvented by residents to suit the needs of residents. Overall, findings on mobility highlighted the need to develop road patterns that service commuters, but also those who remain, who wish to enjoy other mobilities within and across their suburb. Far more consideration needs to be given to local transport planning and to ensure that access to local services is better designed for those in cars, but also those who can walk and cycle. The example on this slide shows that there's also needs to be far more attention given to decentering jobs, retail and other activities into the suburban areas, and to provide a much broader range of local employment opportunities.
Case Study 2, the evaluation of universal design, a collaboration between the disciplines of health and architecture. Although universally designed environments have direct benefits for people who experience disability, universal design does not focus solely on people with disabilities but rather on all people, as we all have differing abilities and size, and no one is immune from aging, frailty, or disability. Current definitions of universal design emphasize it as a design process, and that its outcomes are linked to health, human performance, and social participation. The principles of universal design have been the main tool used to describe and define universal design. They were developed by the Center on Universal Design at North Carolina State University in 1997. And whilst they've been useful in assisting to define universal design, there have been many criticisms of them. Principally, that they cannot be evaluated or benchmarked, and that there was a lack of a body of evidence behind each of the principles. Recognizing the many criticisms of the principles of universal design, the authors of the principles have now developed the goals of universal design. The relationship between the goals and principles of universal design, developed by Steinfeld and Maisel, provide the theoretical framework for this study. Obviously, the relationship is very complex. Regarding how best to evaluate universal design, no study has examined the opinions of the people that work in building design, policymakers, academics in universal design, or people of varying abilities that use buildings. The research team is a multidisciplinary one from health and disability in the built environment. The research premise is that there are currently no reliable or valid methods of measuring outcomes relating to the evaluation of the application of universal design in the built environment. There are perhaps some non-standardized tools, checklists and questionnaires, but no reliable standardized method of evaluating the application of universal design. The aims of the research are to scope the tools that are being used, to understand user experience in using these tools, to ask people's opinions on how universal design is or could be evaluated, and to produce some initial recommendations for designing an evaluation tool. A mixed methods research design was used, combining analysis of quantitative and qualitative data. Literature review and web-based audit has been completed of existing tools and methods to evaluate universal design. Our review included the following tools, both from Australia and overseas: the Healthy Urban Development Checklist, the Age-Friendly Cities Checklist, Measuring Up Built Environment Self-Assessment Guidelines developed by the Province of British Columbia Calendar, Active Living Impact Checklist developed by the National Heart Foundation Australia, the Well Building Standard of the 7 concepts: air, water, light, nourishment, fitness, mind, comfort, innovation, Innovative Solutions Universal Design, released in 2016 by Inclusive Design and Environmental Access Centre in Buffalo, and ISUD, which allows varying levels of credits to be earned according to the degree to which universal design is included in a project. Online survey was emailed directly to people or sent to peak bodies and organisations for them to advertise to their constituents. We targeted expert users and their organisations, professional practitioners, architects, occupational therapists, building surveyors, access consultants, policymakers, government and academics. We asked about what criteria they would use to rate the universal design of a building. Over 800 responses were generated to this question. People either responded by talking about the principles of universal design or about building elements, such as equitable use, or the entry door must be accessible, signage that is easy to read. The vast majority of responses referred to building elements. None referred to the goals of universal design. Semi-structured interview with experts explored experiences and opinions of evaluating universal design in more depth. We received additional funding for Stage 2 in October 2017 through an industry partnership grant between Deakin, the private consultancy Architecture and Access, and the Department of Sport and Recreation Victoria. This will involve going back out to key informants to test our conclusions. We will consider in detail if the principles align with the goals and how both relate to elements of a building. The data will inform an evaluation tool for the application and evaluation of universal design. The tool will be refined via testing by expert users on 10 buildings in Melbourne. These buildings are all public buildings.
Issues around home are broad-ranging and urgent in contemporary Australia. They range across scale from the house to the neighbourhood and larger communities, and all of these various issues are impacting on the health and well-being of increasing numbers of people. They necessarily have to be approached in an interdisciplinary way, and the home group includes 24 experts in health, law, finance, social geography and design who bring their diverse perspectives, but also their research methodologies, policy orientations, and industry partnerships to the group. As a consequence, we are about research that makes a difference, that connects local experiences and concerns to policies and alternatives. A sense of these issues was revealed in our two case studies. One was of an outer suburban housing estate in Melbourne, and what was revealed there was a need to rethink notions of placemaking and mobility in the light of people's experiences who lived in those places. Our second case study looked at the notion of universal design, and it highlighted the importance of evaluating the principles and the goals as well as applications of universal design, and the critical importance of developing a grounded measuring tool for its wider application. In the future, the home group will be working with local government, community groups, philanthropic organisations and industry to develop localised strategies for basically ensuring a home for all. To fund these various research activities, we'll be drawing on these various organisations with whom we'll enter into partnerships, as well as access resources from Deakin University. And as a consequence, we anticipate expanding the number, the reach and the impact of home across not only the state of Victoria, but nationally across Australia.